only place. You can read around it as well, but yeah, educating yourself and being familiar with what the symptoms are so that you can present early. And I'll give you some statistics later on why it's important to present early. But thank you very much for your question. So how common is prostate cancer? Well, it is the most commonly diagnosed cancer amongst men in the Western world. Okay, so where we find ourselves, we just again don't have the data for developing countries. Okay, but I'll tell you, if it is one of the most commonly diagnosed cancers amongst men in the Western world, it will also be one of the most commonly diagnosed cancers amongst men all over the world. In the UK, about 1 in 8 men will get prostate cancer. The figures vary slightly. In America, it's about 1 in 6 men. And who's more at risk? Well, look, people that look like me, and Afro-Caribbean men, African men of African or Caribbean descent, are more at risk of developing prostate cancer compared to white men, Caucasian men, compared to Asian men or Hispanics in the States. But it is a very common, cancer amongst all men of all races, of all nationalities, of all ethnicities. But it is a lot more common amongst African men. It presents at a much more, it tends to present at a much more advanced level in Afro-Caribbean men. Meaning, let's say if a white man presents with symptoms of prostate cancer and a black man presents with symptoms of prostate cancer, and you do all the tests and confirm, yes, it is prostate cancer, the black man is more likely to have a more aggressive form that doesn't respond in the usual, in a very good way to the standard treatment. And also it's more likely to have spread beyond the prostate gland. So this is where we say it's metastasized. And that's one of the difficulties. And there are various reasons for that. Some of it might just be our genetics, okay? Because of our genetics, we just, our prostate cancer presents in a much more aggressive way, advanced way in us, which means we have to be even more vigilant, okay? So we can catch it at a very early stage. But all men have to be very vigilant. This is not just an Afro-Caribbean thing. It's very common amongst all men. But the other reason also is, I think cultural, delayed presentation. Sometimes we overlook our symptoms. We don't go and see the doctors, when we should have. And so you wait and wait. And then you turn up when you finally have absolutely no choice because your bladder cannot get rid of any urine. You go into something called urine retention, or you start having lots of urinary infections, or you start having more worrying symptoms like passing blood in the urine, okay? So if you present late, then you're also naturally, you're presenting and the cancer is doing what it's doing inside of us, you're more likely therefore to have a more advanced form of the cancer at diagnosis. And the more advanced it is, the later you present, the later it's picked up, the lower the chances of a cure. Going back to the question that was asked earlier by Sheku, the lower the chances of a cure. So early diagnosis, early cure. And I can say for the NHS, there is something called an urgent cancer referral pathway, 2-week wait pathway. If you see your doctor, and this isn't just for prostate cancer, but if you see your doctor, your GP, with symptoms, and we know every doctor knows what the symptoms are, but with any worrying symptoms that might suggest that this could be cancer, okay, we can refer you, and you can get seen within 2 weeks. Have tests done like super urgently, quickly, to make sure. To check whether you've got cancer, so we can pick it up early if there is any cancer, so something can be done about it. And if it's not cancer, then we can deal with whatever it is that it isn't. And of course, it doesn't mean every time you go and see your doctor, because you don't want to be super anxious as well and turning up because every other week with symptoms that are not, your doctor will go through and then rationalize with you whether these are symptoms that should make you go and see someone within that urgent framework of 2 weeks. How am I doing? Making sense so far?
Yes.
Fantastic. Good. So that's how common it is. We know who we know that Afro-Caribbean men, excuse me, getting too excited. We know that Afro-Caribbean are more commonly affected. So what are the symptoms of prostate cancer? So I mentioned these earlier. These are the same symptoms as benign prostatic enlargement. So when the prostate naturally gets large, we have all of those symptoms that I mentioned earlier. It can happen with prostate cancer as well, and it's worth just repeating them. So as the prostate gets large, now I'm trying to find something to model this. So if that's that urethra there, okay, that tissue is meant to represent the prostate, by the way. Now, the prostate cancer can be on the outside, okay? And if the growth is on the outside, it's not going to press on the urethra. So you may not always get the difficulty passing urine. But if the cancer cells are close to the urethra on the inside, then as they increase and increase in numbers, they're going to be pressing on the urethra. And so you're more likely then to develop difficulty of passing urine. And so and with those, the typical symptoms are, we normally say, look, you can't hit the back of the pan. Remember when we were all small, especially back in Africa, there wasn't always a pan. You'd be standing upward aside some side also. Mm-hmm. We used to have competitions. I don't know about you guys, but I used to with my friends who started and said, who can pee the furthest, right? And you can, your urine goes really, really far. I can't do that anymore, by the way. I don't think I can challenge the young boys anymore. But what happens with prostate cancer, benign prostatic enlargement, even standing, in front of the urinal, the urine doesn't flow, doesn't hit the back of the pan. It starts to dribble at the beginning. That may happen. Or you stand there, there's something called hesitancy, where you stand, you want it to pass urine, and that's why you rush to the bathroom, and you're standing there and you're trying, you're waiting to go, nothing is happening. You're waiting. Sometimes it could be several seconds, 30 seconds. Sometimes it's like, a minute or more that you're waiting there until finally it comes out. And even then, it's not a lot. It comes out really slow. Now, the other thing you can also have, I mentioned earlier, something called nocturia. That's waking up at night to pass urine multiple times. Maybe once is fine. It is acceptable. And of course, if you've been out late and you've been, drinking lots of fluids, or you have a cup of tea before bed or a cup of coffee, yes, you might get up once or twice. But if you've, not had anything to drink a couple of hours before bed, and then you're waking up 2, 3, 4, or more times, then that's concerning. So that's nocturia. Now, you may also start to develop more worrying symptoms. So naturally, women tend to get more urine infections because of the anatomy, okay? They get more urine infections than men. When a man gets a urine infection, and if you're a man and you're there watching this, if you get a urine infection, someone says, a doctor says, a nurse says you've got a urine infection, don't just say, yeah, I'll take antibiotics and that's fine. Because men should not be getting urine infection, period, because our anatomy makes it very unlikely for us to get urine infections. And so if you're a man and you get a urine infection, you should be asking, should I have some further tests? It doesn't mean it's prostate cancer, by the way, okay? These are just clues, okay? But should I be getting some further tests, okay? To look into, is there something wrong with my bladder, something wrong with my kidney, something wrong with my prostate? Most of the time there isn't anything, but it's, picking things up early. Now, sometimes if the prostate cancer protrudes, into the urethra, you might actually pass blood in the urine. It's not a very common symptom of prostate cancer, but you might pass blood in the urine. And if the cancer has moved to other parts of the body, commonly prostate cancer likes to go to the bones, and it usually goes to the lower back bones. If all of a sudden, you've never been experiencing back pain and you start to get back pain. Now, I'm not saying, because you fell and hit yourself, that's a reason for your back pain. Or you've been doing a lot of heavy lifting, not bending properly, that's understandable. Or you've always had a niggle in your back, but pain that comes out of the blue, and especially now, any pain that starts to wake you up at night from your sleep should be concerning. Okay, you start to get those pains, see your doctor. Doesn't mean it's prostate cancer, but again, it's one of the things. Okay, so those are some of the symptoms of prostate cancer out there. There are some others as well.
Right, Doc. Sheku has got a question again for you. DJ Little, can you just read that out? And then I've got a question as well for you.
Okay, no problem. Thanks for that. Doc, the next question from Sheku again, he says, first of all, he said, thank you for your response, Doc. I have another question. How can you know that you are having or developing prostate cancer? Any advice on how to detect or spot the signs of prostate cancer? I think you've just spoken about this. You've just responded on this. And then also he went on and said, hello, my question is, passing blood in your urine sample mean is a sign of it or sickle cell trait? So
yeah.
He's asking two questions there, and one of them which you probably responded to, and then the second one is trying to find out whether if you pass urine, blood in your urine, would that be related to sickle cell, or is that a sign of prostate cancer as well?
Yeah, no, thank you very much. I think in regards to Sheku's question, hopefully Sheku is happy with the answers that I've given as I was talking about the symptoms, right? So knowing those symptoms and seeing a doctor early would be the right thing to do. And the other question about passing blood in the urine, now, we should never see blood in our urine. There are people who take blood thinning medication, even like warfarin, okay, or some of the newer ones, rivaroxaban, apixaban. Now, even you should not have blood in your urine, okay? If you have blood in your urine, that means there's something wrong. If you're taking blood thinning medication, it just means that you will have more blood, the blood will be more. You're passing blood because there's a problem in the first place. Now, is it a sign of prostate cancer? But no, it doesn't always mean it. There are lots of things that can cause blood in the urine, urine infection, but prostate cancer is one of the things. You can also have blood in urine because of kidney stones. Blood in the urine because there's some of the people on this show tonight have ran marathons. Sometimes if you run really long distances like marathon, you can pass blood in the urine as well. Soldiers are known for that because they do long, especially those who do long matches. After really long matches, they can pass blood in the urine. That's a recognized thing among soldiers and marathon runners at times. Is it a sign of sickle cell trait? It's not a common sign of sickle cell trait. Passing blood in the urine. It's not a common sign of sickle cell trait at all, as far as I know. But can you pass blood in urine for other reasons because you have sickle cell trait? Yes, it is possible for that to happen. And again, the causes, like any symptom that I mentioned, can have so many different causes. And whilst it's good to do your research, to have a look on the internet, most of the time when you put one thing in Google, you're going to get the most scary thing. Now, what I'm trained to do, and other doctors and clinicians, is we're trained to put together your symptoms that you may be experiencing, but also ask you other questions to help us work out what it is that's going on in your case. Because 5 people can be passing blood in your urine, But if once I've spoken to all 5 of them, you all might have 5 different diagnoses, okay? And I'll be able to tell you what those are. By all means, do your research, but then don't sit on it or be reassured or panic and get scared and really anxious. Go and then see a doctor and say, well, this is what I'm worried about. And actually say, you know, I read this on the internet, I'm quite worried. So we can go through things with you and see if that's what's going on. Yeah.
Thank you, Doc. My question is, I'm sure there's another question from Abubakar Bangura. But my question, let me ask my question first, and then I'll let DJ Little to actually read out that question. For people, for guys watching this program tonight, some of us, we are in our 40s, late 40s, and over 40. For everyone watching this program tonight, what advice can you give them to actually, because sometimes our GPs will write us letter, they will send us letter like, you need to go for your prostate check, your MOT, but we'll take that letter and put it under the carpet, refuse to go, saying, what good did you send them? Go tell me saying, so. How important is this to us men?
So really, really good question. You know, thank you so much for asking that. Now, this is about fear, right? Fear and anxiety. And what is fear? Fear is really simply is the anticipation of pain. And when you look at that definition, the anticipation of pain, the pain hasn't come yet. This is in the future. But you start going through all sorts of things in our mind. Oh, what if I go and do this test and then they tell me that it's this? And, you know, you're scared about something that hasn't even come to pass. And as a result, you might then put yourself at risk. Remember what I said earlier, the earlier we diagnose anything, not just even cancer, the better the treatment can be put in place, whether that's diet, whether that's exercise, whether that's medication, whether that's, you know, having surgery, or whether it's a combination of all of those, or chemotherapy. The earlier it's diagnosed, the earlier you know what's going on, the earlier things can be put in place. And, you know, so when you receive these letters, you know, this is like, it's like someone chasing you to, you know, and telling you that, look, there's something really good out there for you. Come and get it, you know. And then you're saying, no, I don't want it. I don't want to find out, you know, what might be going on. So if you get these letters, respond, interact, you know, engage, you know, go and have routine tests done. And when you hit your 40s, you'll get a, you know, like a letter from your GP. It comes through the NHS to go and have a well-man, well-woman check, where they check everything. They check your weight, check your height, check your blood pressure, cholesterol, do other tests. Now, they don't always do a prostate-specific antigen test, which I'll come on to in a second, the prostate blood test. But they may do it in your case because of certain risk factors, and they will go through that with you. Really, really important. I mean, public health, this is all about public health. It's about prevention. Sometimes it's hard to get the message across about prevention because you've not had any symptoms. And so you wonder, why do I need to do anything? If we get a chance later, I might play you a video about men who experienced prostate cancer and how their approach to life in general changed. You know, most of them were, I've never been to the doctor for 20 years. And then all of a sudden, boom, a brother, you know, a relative got diagnosed with something. So they went to see the doctor. They did routine tests. They didn't have symptoms. And then they were also diagnosed. So when you get these letters, really, really do go. Okay. And some of the things that worry people as well with prostate cancer are some of the tests. And, you know, and I'd like to go through what those tests might be. If this is a good time, DJ Ish.
Okay, no problem. DJ Little, I just want you to read, Abubakar has got a question, and then Shola ask a question as well. So if you can just go through that, please.
Sure, can you hear me?
A little bit faint.
All right, can you hear me now? Sorry.
Yeah, better.
All right, thank you. Right, so the two questions that have come through from Abubakar and Shola really, these are really, really good questions there. It says, Abubakar says, is there any link between eating loads of fatty foods and some other types of cancers? And then Shola says, please, when a back pain is constant and coming up severe and going down to the leg, what could that be?
Okay. Thank you so much. I mean, that and is related to obesity. Obesity, we know, is one of the biggest risk factors of cancer nowadays. Lots of studies have been done to prove that. About maybe 10 years ago, the stats were 1 in 3 of us will get cancer in a lifetime. Now it's about 1 in 2 of us. Okay, and that's in part related to the increase in obesity. Yeah, it's always hard to prove some of these links, but when you look at people who are developing these diseases, these illnesses, you can see that, yes, obesity plays a big role, and eating unhealthily is linked to obesity. In terms of the back pain, I was looking at the chat. I think someone has kindly answered the Shala's question, right? That it could be trapped nerve like sciatica. So I think, yeah, I mean, that is, based on what you're saying, it sounds like it could be that, absolutely. But again, there are questions that you will get asked on a one-to-one with your GP to make sure it's nothing else, other than that. So if you have any concern and it's not going away, now usually sciatica should resolve within 6 to 8 weeks of acute onset. Sometimes it goes on much longer than that, but if it's going on for longer than that and not getting easier at all, you should certainly see a GP to have a look at it. And also, if it's really keeping you awake at night, you should see your clinician as well.
All right. Thank you, Dr. Achmed. Thank you. And I'm sure Shola and Abubakar, I hope Dr. Achmed have done justice, and Isata actually contributed to that question as well. I hope these answers have done you justice. DJ Little, I don't know whether you've got any question for Dr. Achmed before I move on.
Not particularly, DJ Ish. I think Dr. Achmed wanted to move on to another illustration.
Test, yeah.
Yeah. So I'm quite happy for him to proceed.
Okay.
Brilliant. So now let's say, look, you've got all of these symptoms, and you spoke to your GP, and they're also thinking along the lines, well, look, it'd be really important for us to check whether or not you have prostate cancer. So there are various things that can be done and that usually get asked for. So first thing is, when you're at the surgery, at the consulting room with your doctor, one of the tests that your doctor might actually ask you to have done is something called a prostate examination, a digital rectal examination. Now, look, let's just say this straight. This is putting, if I was a doctor, I'd be putting my finger up your bottom, okay, to feel your prostate. But that is really the only way to directly feel the prostate. So the prostate, goes around. Everything is so interlinked down there. It goes around this urethra, but it lies very close to the rectum, so the lower bit of your colon. And if you put a finger inside the rectum, you can actually feel the prostate. And it has, in a young, healthy man, it's nice and smooth. In an old, healthy man, it's smooth, but quite big. Okay. Now, when there are problems, when you actually feel it, you can feel, it's not smooth, that it's irregular. Okay. And that can be really, really helpful. Now, if someone has a lot of symptoms that suggest you may have prostate cancer, and I do that exam and it's still nice and smooth, you could still have prostate cancer. Remember what I said earlier, that let me come back to, I don't have a good analogy here, but if that is your, if you have the urethra, that black thing you can see there, and you have the prostate gland, if the prostate cancer is growing in the inner bit of the urethra, around the urethra, it may not have actually done anything to the surface of the prostate gland. So, you could go in and feel, and it still feels smooth on the outside, but the problem is on the inside. Okay, but if the prostate cancer is, is developing towards the outside, the outer part of the prostate gland, then I'm more likely to feel an irregularity. So none of these tests by themselves can absolutely tell you whether or not you have prostate cancer. It's about putting all of them together. Okay, the digital rectal examination itself, to be honest, really only takes about 5 or 10 seconds. It's really, really, really quick. Okay, we do it using, of course, gloves on our fingers, and we use lubrication, and it's really, really well tolerated, and it's, as I say, it's really, really quick. It's nothing out. People get embarrassed about it, but I'd say don't be. It's better to have the right test and then have the correct diagnosis. And if it is cancer, get treatment started early, than be embarrassed by someone having a look at your prostate gland. If you feel more comfortable to see a male doctor, ask for a male doctor. Okay, there are women sometimes with intimate female examinations who ask, Dr. Kamara, I hope you don't mind, but I'd really like to have a female doctor examine me this time. Absolutely fine. And sometimes I even just ask them, are you comfortable with me examining you? Okay. And if you're not, and even if they say they're comfortable, and then I go further and I say, look, would you like me to ask a chaperone, a female colleague, to just be in the room, just to make sure that, you're very comfortable and everything, goes well, because we don't want to cause upset to any patient. And you can ask the same as well. As a man, you can ask for a male chaperone if that makes you feel more comfortable. So that's the digital rectal examination. It's really, really important. It's really quick. It gives us a lot of information. Okay. And then the next thing is blood test, PSA. Okay, prostate specific antigen. This is a chemical that is produced by the prostate gland. It is produced by every prostate gland, so there will be some of it floating around in our body. Okay, and we have levels of it that is normal at different ages. Again, because of the natural benign enlargement of the prostate gland, as a man gets older, the normal cutoff goes a little bit higher. But it can be very, very high, if there's prostate cancer going on. But other things can make your PSA go up. So sometimes if you've just had a rectal examination and you go and do a blood test, that can put your PSA up a little bit. If you've also had a recent urine infection, that can put your prostate gland up. If you've gone into retention for other reasons, so this is where you're unable to pass urine out of your bladder, that can put your PSA up. Okay. Now, if your prostate gland is just too large, it's not cancer, but it's just benign enlargement and it's just really big, that can put your PSA up. If you have a prostate gland infection, we call prostatitis, that can put your PSA up as well. So, there are lots of things that can affect your PSA. So again, by itself, doesn't, it won't diagnose prostate cancer, but it's putting everything together. Okay. Now, if there's still increased concern, then we may want to directly visualize the prostate gland and even take a biopsy from the prostate gland. I won't be doing that as the GP, but I'll be referring you to my colleagues. We call a urologist with a U, urologist, and they'll do an ultrasound scan, usually from inside the rectum where I put my finger. There's a little tiny probe with a camera on the tip that can directly visualize the prostate gland. And they can take biopsies of the prostate gland. And usually they'll tend to biopsy, for those of you who don't know, that's putting a needle into the prostate gland and taking a sample out that can be looked at under a microscope in the laboratory. And they will usually do somewhere around 6 to 10 biopsies from different parts of the prostate. Because if you just go into one area where the cancer isn't present, you may miss it. Okay, so they look at different areas. And if all of those come back entirely normal, it means your risk of having prostate cancer is low. It doesn't mean it's impossible or it's zero, because again, you're only taking up to maybe 10 biopsies. If your prostate gland is big, you might miss it. Okay, so that's why we do the finger exam, we do the blood test, we do the biopsy, and still, if there's concern, they'll do an MRI scan, magnetic resonance imaging, which is like a 3-dimensional imaging visualization of your prostate gland and everything else around your prostate gland. Again, to have a look at things, and that can also tell us if there is cancer, whether it's spread to anywhere else outside of the prostate gland. So it's a combination of the results from these various tests that will tell the urologist and the prostate cancer specialist, that will inform all of us whether or not you have prostate cancer and therefore, how to treat it. And that's the next thing that I'd like to talk about next, the treatment of prostate cancer.
Right. Okay. DJ Little, I don't know whether you want to read some questions for Dr. Achmed, because I can see ICETA is engaging as well by answering some of the questions that are asked by the audience.
Yes. Okay.
Can you hear me?
Yes, we can hear you.
Okay. First of all, I just want to say a huge thank you as well to Aissata Cissé Jallow for response and our support. Just bear with me. Thank you to Aissata Cissé Jallow as well for our support that she's offering out there, responding to some of the questions that are coming through. So we really appreciate that as well, coming from Aissata Cissé. Well, I wanted to ask a quick question to Dr. Achmed. I'm just trying to get myself on camera. I think I've got.
DJ Little, can you increase your volume, please? Or you go close to the mic?
Can you hear me?
Yes.
All right. Thank you. Sorry about that. Yeah. So what I was going to say is my question to Dr. Achmed is you've kind of touched on it, but I wanted to still say a word or two and then ask a question there. It's where we've got, generally as men, we have this macho-ness and egocentric and all of that sort of thing that surrounds us, and ensuring that the last person I want to be presenting myself to be going into my back passage, so to speak, and to do some checks on me will be a doctor, somebody I don't know, so to speak. And it has to have a lot of courage. It has to require a lot of conviction for you to be able to put yourself into that position, removing all sorts of humility and pride, and getting that done. So then we find ourselves starting to demonstrate or present some sorts of signs and symptoms which may slightly be or not be cancer-related illnesses. What can you say to us? And I know you've touched on it, but how can one, it's easy for you as a doctor to say it, but how do you convince a 45-year-old, 46-year-old, 50-year-old African man who is in command of his own castle, so to speak, to be able to move forward and present themselves to a stranger, be male or female doctor, and say, look, this is what's been happening. My partner, my wife, my girlfriend has asked me, and finally get me out of the house to come in and get this done. What can you say to somebody that's reluctant or is on the fence of coming forward?
Yeah, you touched on a really, 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 really important point. And whether you're 45 or younger or older, this is something we see not just even with prostatic symptoms. What's really, really important from our point of view, healthcare practitioners' perspective, is it's developing that rapport. Okay, look, there are some people that will come and will be like, Doc, look, this is what's happened. I know I'm worried about this. I know you're going to need to examine my prostate gland. What do I do? Do I just lie down over there and you do it, and let's get it done? Okay. Some people are like that, and you don't have to. But some people, even like culturally, it's, they've never exposed that part of themselves to anyone, maybe other than their loved one, their partner. So it can be really, really difficult. And then there's that fear, there's that anxiety. What are they going to find out? What if I have got this thing, this prostate cancer? And then the thing is, I always say to people, look, it's always best to find out early, because you can be cured if it's picked up a lot earlier. And if it's not that, you can then be reassured. So it takes away that anxiety. But without knowing you always have that anxiety hanging up on your mind. And too much stress, anxiety, it's too much cortisol. That has lots of other implications. It's not good for your heart. It's not good for your for diabetes later on. But when someone, if you're the partner of, this avatar of a person that DJ Little described, well, you've done that great job. You've motivated them. They've come along. If you can also come along with them, that would be great as well. Okay, because sometimes in the consultation they might just freeze. They might not really tell us all of their symptoms because again they're worried about what we'll tell them might be going on. But you might then be able to clarify some of the symptoms that they may have been saying. They may be so nervous that they even forget what they wanted to talk about. But you might be able to chip in and advise. So look, if you've got any symptoms, prostate cancer or not, that's worrying you, that's bothering you, that's keeping you awake at night, that's making you look on the internet, that's causing you concerns, and you're telling your loved ones, your friends about it, that's you should be going to see a doctor. Okay, don't hesitate, don't delay it. Cancer is all about picking it up early, diagnosing it early. That way you have a better chance of cure. It's the same with all illnesses. But we emphasize this more with cancer because we know that the early diagnosis and treatment makes such a huge difference in terms of the outcome. So look, I'm encouraging everyone out there we're talking about prostate cancer today, but if you've got any of those prostatic symptoms, you're waking up multiple times at night to pass urine, maybe you saw some blood in your urine. Well, it only happened once, therefore, no, it's happened. You should never have blood in your urine. Go and see your doctor. You're going, your urine stream is extremely slow, or you're going during the day multiple times to pass urine, and it starts to worry. You start to plan your journey. I need to make sure that I go by, a pub or a restaurant so that I can quickly run in, or if there's no McDonald's around there, I'm not going to go out to that, I'm not going to take that route. For a lot of people, COVID made going out very difficult because they couldn't just stop somewhere and go and pass urine. So yeah, no, thanks for those questions. And yes, thank you, Aista Sise, for the tremendous role you're playing. I'm watching the chat. So for all of you out there who are interacting with Aista is a cancer specialist. She's a healthcare practitioner as well, but cancer is, is what, her area of expertise. So, just take everything that she's telling you as gospel. Okay.
Thank you. Thank you, Dr. Achmed. DJ Little, there's a question from Francis Bangura. Can you just read that out, please? And then I have a question for Dr. Achmed as well, please.
Okay. So we're keen to, I'm sure Dr. Achmed is keen to move on to the cures.
Yeah, after this, yeah.
So Francis is saying, can inflammation of the prostate progress to prostate cancer? Basically, can inflammation of the prostate progress to prostate cancer? And after Ish's question, whilst I'm on the mic, the second question following Francis's question would be, is prostate cancer likelihood to be hereditary? That would be mine as well.
Yeah. Very good. So, can inflammation lead to prostate cancer? It is theoretically possible. I mean, inflammation is, you get a lot of inflammatory cells or white blood cells. They come over to a particular area of the body. You get a lot of fluid being produced, and you get swelling of the tissue. Okay, but that's usually because of an infection of the prostate. We call that prostatitis. And if you treat that, usually it goes away and everything settles down. It dies down. It doesn't, cause cancer. But remember what I said. Prostate cancer develops, or cancer anywhere of the body develops, because you have lots of cells dividing really, really fast, and they get out of control, and all of a sudden the body can't control them anymore. It's like there's a revolution of the cells against the natural control within the body, and they can't be controlled anymore. So if you have inflammation, that makes your cells divide really fast as they're trying to repair themselves, and that is when that is when there's likely to be errors in the genetics within the cells that can then lead to them going out of control. So yes, theoretically, an increased risk of you developing cancer, but it doesn't necessarily mean it will develop into cancer. But it's all the more why you should get treated if you have prostatitis. Prostatitis is really painful. When you pass urine, it's extremely painful. It's more painful. The burning, stinging you get when you pass urine is it's more excruciating than just having a urine infection. And if a doctor feels your prostate, you might want to punch me in the face if you've got prostatitis, because if I press your prostate, it's like so painful. The most painful thing, you're like, you almost want to jump off the couch. So that's one of the things with prostatitis. Now, is prostate cancer hereditary? Really great question. One of the risk factors for prostate cancer is having a first-degree relative that has developed prostate cancer. So your father, a brother, and also other, close relative like a paternal uncle. Okay. Now, this will interest you. There are cancers in women, female members of the family, that will increase your risk of developing prostate cancer. So if you have a first-degree female relative who's developed breast cancer or ovarian cancer, that can also increase your risk of developing prostate cancer. Is there one gene that that has been detected that we know is passed from one person generation to generation? No, there isn't one. It's likely a multitude of genes, but we know that if you have a first-degree relative with prostate cancer, it's even more reason why you should be seeing your GP. Why, even if you don't have symptoms, you may actually want to ask for PSA, especially if you're over the age of 40 and you're a Black man and you've got a first-degree relative with prostate cancer. Go and get the first test done, at least so that you have a baseline PSA if you find yourself in that situation. You have a baseline PSA. So if anything, if you then develop symptoms and they recheck it, they can see whether or not it's jumped up, so that something, prompt action can be taken. All right, let's go into treatment. Is that all right?
Yes. Dr. Achmed, quick one before you go on to that. Because I know for us coming from Sierra Leone, we're used to this habit back home, like when we start struggling to pass urine, and then we start having some symptoms in our urine. But what we do, we tend to take antibiotic, red and black capsule, all this antibiotic back home. Yeah, and then we're now here, wherein we've got all the cure, all the diagnosis here, but we still live on that same system wherein we're having these symptoms now, but we tend to hide from our partners. So what we do, we ask for all these antibiotics, start taking them, thinking the infection will go. What advice do you have for us men tonight?
Great question, DJ Ish. Great question. There is a lot of health inequality, even here in the UK, where we have exposure to all of these facilities, as you mentioned. And the health inequality isn't because you're being discriminated against, but it's because you're allowing yourself to be discriminated against by, lack of use of the system that's available to us. There's a lot of self-medication. There's a lot of fear. And I'm not talking about people who, we all know how difficult it is if you don't have paper, legal status in this country. It can be difficult sometimes. But let me also say this. Whether you have legal status or not in this country, you have the absolute right to be registered with a GP. And if a GP surgeon refuses you, you can take it up with NHS England. And there are a lot of surgeries advocating that. They will help you. So don't be scared, even if you don't have proof of address. Okay, I just thought I'll say that. But look, a lot of people self-medicate. They want to feel better and don't want to get a second opinion and have tests. I mean, we don't want to over-test and over-investigate if it's not necessary, but we can have that discussion and say, look, your symptoms don't really suggest anything worrying, so let's do this. Or we can do simple tests. Rather than guessing, taking antibiotics for what might not be an infection, we can do the urine test for you, and tell you whether or not you have got an infection. Maybe it's something else. Maybe it's not a urine infection in the typical sense. Maybe it's a sexually transmitted infection. There are also lots of other things. You know, some people can have like sort of little growths in the benign growths in the urethra, and that can cause pain. That can make it difficult passing urine. You know, there's so many things that can be going on. So don't leave it to chance. You know, see a doctor and get tested. I mean, you're living in one of the best in one of the countries with the best healthcare system in the world. You know, no matter how much people complain about the NHS, it is absolutely amazing. I get patients who from Europe. You know, I mean, I'm not even going to talk about the States, but you know, in Europe, everyone pretty much has got to pay health insurance. I mean, out of pocket. You go to hospital, they expect to pay something towards the care they're receiving. The state helps, but they expect to pay. And when they come over to the UK for the first time, they're really surprised. I don't have to pay. I mean, and of course, in America, the first thing they ask you when you go to hospital is, what is your health insurance? I've been there, worked there for a couple of weeks. So what is your health insurance? If you have the right cover, you can have this test. If you don't have the right cover, you can't have this test. So, you know, make the most of it. I think that's a really good point. Thank you for bringing that up, Dijesh.
Yeah, you can move on. You can move on. Yeah.
So fine. So in terms of treatment then of prostate cancer, you've been diagnosed with prostate cancer. Now we talked about cure earlier. So all the tests will tell us, well, is the cancer just within the prostate? And if it's just within the prostate, the aim is to remove it all. Okay. So you have what we call prostatectomy, radical prostatectomy, where they remove the whole of the prostate gland. It's a very difficult area to get to. But they're very skilled at doing it now, to the point where they even use they do robotic surgery to remove the prostate gland. You know, so you don't have a huge cut at all. I mean, it's still major surgery that's going on within you, but it's, you know, done really skillfully. So if the prostate cancer hasn't spread beyond your prostate gland and they remove all the prostate gland, then you're cured, okay, theoretically. I mean, you can't see, if one cell has moved and gone somewhere else, you can't see that. Or if it's spread to, let's say, what we call a lymph gland, the lymphatic system, then you can't see that, and it could then spread further. So that surgery, radical prostatectomy, is one of the sort of curative measures. Now, if the cancer has spread beyond the prostate, they usually will not do prostatectomy, because there's no point. If you remove the prostate, well, you're only removing some of the cancer because it's spread somewhere else outside of the prostate gland. So that's why they may not offer you prostatectomy. Okay, the other curative option is radiotherapy. Okay, this is where they use high doses of radiation, very much more powerful than X-ray radiation, to kill the cancer cell. They really target it. But again, they can only target it so much. So there's risk that you're also going to hit, the cells of some of the other organs in the area, especially in your rectum, which I mentioned earlier. That's where we put our finger to examine the prostate. So that can cause problems with the rectum. It can cause inflammation. It can cause bleeding sometimes in the rectum when you go to the toilet. But again, these are not reasons not to have it. These are things that are known to happen, and your oncologist, your cancer specialist team, they will treat you. They will give you medication to reduce those side effects. And if you develop any, you come and see us. Come and see the GP as well. There are side effects, as I've started talking with any of these treatments. For some men in particular, one of the things they worry about most is erectile dysfunction. That is one of the side effects of radiotherapy or prostatectomy. And some men, I can understand. Look, if you're going to have erectile problems, but lots can be done about it. Studies have shown that if you start after surgery, if you start using Viagra early, it's almost sort of like rehabilitating. You hurt your arm and you start doing physiotherapy. So it's like you injure the penis, you start doing physiotherapy with Viagra, okay, to try and help it be able to function better earlier. There are also lots of other things. The surgeon, they try and avoid the nerves that affect erection if they can. Okay, they do their very best, and that's why robotic surgery is really, really helpful nowadays. And so if, let's say, for example, someone isn't amenable to radiotherapy or surgery because the cancer has spread, or they had radiotherapy or surgery a few years ago, but the cancer has come back because maybe there was just one cell that you just can't see on a scan, then the next thing that they give you is hormone therapy. Because one of the things that makes your prostate gland, do what it does, and I didn't even tell you what the purpose of the prostate gland is at the start. The main function of the prostate gland is to produce seminal juice, seminal fluid, not seminal juice. Seminal fluid, not juice. Seminal fluid helps, that is most of the fluid when a man ejaculates, okay? Most of that fluid is seminal fluid. You have the sperm swimming in there, and it's really, really useful, really healthy for the sperm. And what helps it to do that is testosterone. We've all heard of testosterone is a hormone that men in particular produce a high amount of. Now, if you've got too much testosterone and you've got prostate cancer, it's going to be like stimulating the prostate cancer cells even more. So they give you a hormone, that suppresses the amount of testosterone that you produce, so that you don't get stimulation of the prostate gland and of the prostate cancer cells. Okay, so they use this hormonal therapy. That's the mainstay sort of medical therapy. If surgery or radiotherapy has failed or isn't, can't be done. And then there is the typical chemotherapy drugs that they may use for other cancer treatments, but that's not the first line medical treatment in prostate cancer. But your cancer specialist doctor will talk to you about all of this. And so that's a treatment. And the big side effect, as I mentioned, is erectile dysfunction that a lot of men worry about. But a lot can be done. You can be rehabilitated. And what a lot of the big major cancer centers do, prostate cancer centers, is they actually have other men, before you go and have your surgery whilst you've been cancelled, there's a lot of support out there. They have other men who have been through the procedure come and talk to you. And they'll talk to you about what their experience was, and that perhaps, your fear of erectile dysfunction isn't as big as, as major as you might be again. And, you have all this anxiety. It's not as major as you might be anticipating. We said earlier that pain is, fear is the anticipation of pain. So it's not as big as the anticipation. So there's lots of treatment available out there. And, diagnosing it early is so important. If you diagnose prostate cancer early, 90% of men who are diagnosed early will be alive 5 years or more later. But if you diagnose it when it's more advanced, then 70% of men who are diagnosed with advanced prostate cancer, unfortunately, will be dead by 5 years. So that is a huge contrast. Diagnose it early, 90% will be alive 5 years or more later. Diagnose it late, 70% of men, unfortunately, will be dead. So it is down to all of us, to make sure that we present early to give us the best chance of a diagnosis as early as possible, whatever that means. It might not be at the very, very early stage, but as early as possible so something can be done about it.
All right, thank you very much, Dr. Achmed. DJ Little, I don't know whether you want to read any question on the chat.
Yes, I would like to engage. I've got quite a lot of questions myself that I want to present to Dr. Achmed in terms of the treatment.
I've got one as well.
It's very exciting. But first of all, are you in competition?
No, I'm not. I wanted to ask.
No, just steady. What I mean? You're so competitive, you can't even control yourself. Achmed, just hang on in there. We're like this. Okay. Right, people. So let's go for what Edward Benjamin has said. I'm going to give you a flurry of questions. So the first comments, I think you touched on it. Isaac Assise said early detection save lives. And then Edward Benjamin said, does sex help with prostate cancer? I don't know what he's trying to imply, but I'll leave that to you, doctor, to answer that. And Edward Benjamin I can't. And I couldn't follow up on the next question afterwards. And then Donald Kamara says, over 20 years ago, I was told I have an enlarged prostate, but that I was okay. Within the last year, I have had tended to pass urine frequently, both day and night. I have had blood tests for let me just expand this, for prostate cancer, and which shows no cancer, but I still pass urine frequently. I now have a urology appointment in early December, but is my current panic and worry about prostate cancer justified? That's a very interesting story. So it's sort of like Donald has kind of put you in the position to understand what's going on there. And I'll let you respond.
Thank you so much for both those questions. Does sex help? So it's floated around in the scientific literature that, and it's not in a huge number of studies, but some studies have shown that frequent ejaculation can reduce your risk of prostate cancer. So you can ejaculate by having sex, you can ejaculate by masturbation, right? So the question is more about ejaculation. There are some studies out there, but there are also some other studies that have been done to prove the same thing that haven't supported that. But yes, it is out there that more frequent ejaculation can slightly reduce your chances of developing prostate cancer. Now, onto Donald's question, enlarged prostate over 20 years ago, and then the frequent urination there at night. It'd be interesting to know how often that's been happening, whether that's something that's just been happening, gradually getting worse over the last 20 years. If it's something that's been happening and gradually getting worse over the last 20 years, then I'm a little bit more reassured, especially if you've had the PSA test and maybe hopefully your GP has also done a rectal examination at some point over the last couple of years. And if you've had more than one PSA test and those PSA tests have all been quite reassuring, then I think the likelihood of cancer, and nothing is never in medicine, first of all, but the likelihood of cancer is much, much less. So that's what I'd say about that. But if, of course, when the symptoms are more sudden, more acute, then you always worry about, well, has there been a sudden change somewhere? Okay, but I think you've done absolutely the right thing by getting you to see a urologist. You are now going to see a urologist. And so I'd say, look, as much as I'm a doctor, I'm also a patient sometimes. Sometimes I also have symptoms and I need to see my doctor about it. So I understand the anxiety that patients go through. But as much as you're anxious about it, I think, focus on positivity, because I think that will do you much better. Read around your symptoms, don't freak yourself out. You're now going to see the urologist and they may do further tests. But I suspect in your case, it may well likely be this benign prostatic enlargement. And they can either give you medication to help with that. If you've already had medication and it's not helped, they can do a relatively simpler surgical procedure that doesn't involve removal of the whole prostate, but where they just make the opening where the urethra passes a little bit wider so the urine can flow better.
Wow, thank you very much, Dr. Achmed. You talked about the cure here, and for someone who have been through the cure and then you go through the rehabilitation process wherein some people struggle to have erection, so they will recommend Viagra to help. So what about in the case of if that individual is suffering from a heart condition? Is that safe for that person to be using Viagra? Because obviously we know how it works.
Very, very good question. Let me put it this way. What if somebody has had a heart attack? So they've actually had an insult to the heart and they have erectile dysfunction. Is it safe for them to use Viagra? Not straight away. Not in the first 3 to 6 months. And usually we normally say not in the first 6 months. and it also depends on what other heart medications you're on, and we'll give you advice on when to take it so that you don't have major complications with using the Viagra. And it's usually things that are nitrate based. So if you're on a medication called GTN where you have to spray under your tongue, if you take Viagra, you shouldn't use GTN within 24 hours of taking Viagra, because it can aggravate a significant drop in your blood pressure, which isn't good. But yes, so let's say you have a heart condition. So basically, the reason why I started with that is to say, look, the ultimate heart condition you can have is a heart attack. And yes, 6 months after a heart attack, we can safely get you to start using Viagra again. And a lot of men who've had heart attacks who previously had erectile dysfunction are extremely happy about that. In fact, it's not just the men; their partners are also extremely happy about that as well. So, if you've had a prostate surgery and you've got a heart condition, yeah, you can safely use Viagra. Now you can buy Viagra over the counter. Don't just go and buy it and start using it. Speak to your doctor about it, because again, as I was saying, there may be some medications you're on that might make it safe or not so safe. And we might need to tell you, look, within 24, 48 hours of using Viagra, don't use this particular medication. Yeah, so that's, because now you can buy Viagra without prescription from chemists.
Thank you. DJ Little, I think Abubakar have got a question as well, and then we will leave the floor to Dr. Achmed to just wrap up.
Okay, so Doc, following on from Abubakar's previous statement and question, he says, well, I think you kind of answered up.
Answered, yeah.
So, but what Abubakar was asking is Viagra safe for man with high blood pressure?
Yeah, we do give it quite a lot. And again, don't go and buy it yourself over the counter. Speak to us, because some of the medicines we use to treat high blood pressure might not go well with Viagra. So we may need to change your high blood pressure medications.
So anyway, Doc, I'm just fascinated that the men on this platform, including Mr. DJ Ish, are only interested about purchasing Viagra should in case prostate cancer becomes, God forbid. But why? There are other ways that you can entice yourself, stimulate yourself, and keep yourself going whilst you endure your cure and magnify your relationship. Do you know what I mean? Well, why suddenly Viagra has become prevalent towards the best, or as the best substitute towards, or at least, if I go through my prostate cancer treatment, the best thing I need for you, but I go for use Viagra afterwards. You know what I mean? What are there other? I think what we need to do as men is just try to close and shut that door, because there's a very fascinating story which I'd like to share, and I'm sure the person concerned will not mind. I can remember when he had his prostate cancer, and when he was going through his treatment, after a period of time, obviously, and as you could say, as it said, he wasn't able to perform as his best. So obviously, you sometimes what I tend to look at, I don't just want to focus on the men. So he lost a relationship was very significant to him, which was daily, because the partner could not hang on to wait for that prolonged period of time whilst he can identify himself as a sustainable man again, so to speak. Anyway, so, and then word got out on the street to say, well, why this was the reason why the partner had left, because he's not functioning or he's not capable of, and that can hit you as a man. But anyway, with that said, so what happened is that the word got out, and then it became like to taunt the person, so to speak. And so that taunting, and then, but it was coming up to the time when he was identifying himself, beginning to identify himself as a full man again. And then one of these days, a woman dropped the comment to say, oh, I really say, they perform very well as a man. I say, well, when you ready, you can't test me. And so lo and behold, the woman took up on that challenge. And I think she regretted the day she took up on that challenge. So everything that has been accumulated for the last year or so, he unleashed on her. And so she was the carrier of the message to say, "Hey, that man not to buff man again." So basically, what can you say? Because we tend to see, and prominent relationship can break down in this sort of thing. And it's not just, okay, today we're talking about prostate cancer, but it also happens in the reverse, where if you're a man and then your partner is having breast cancer and going through treatment, and you can tell your sexual drive can deteriorate, you're not in the mood for all of that sort of thing. And relationships tends to falters. Either way you look at it, whether it's the man leaving the woman leaving the man. Just before we round up, I know it's not a relationship topic, but but you cannot talk about cancer and don't talk about relationship. I can remember many years ago, Isat and I did a real role play, and where we actually really hit the community about the significance of that role play, because we were able to highlight so many of the simple things, the common factors that can affect a relationship when one's partner is undergoing treatment, where the other partner can do. So what can you say? Because I'm sure you see this sometimes in your surgery, where you can see almost the conviction or the lack of conviction from the supporting partner to being around and say, you know what, I don't even know whether I can do this, doc. How long am I going to wait for my wife to go through this breast cancer treatment? Or how long am I going to wait for my husband to get fixed on this? You know what I mean? The temptations are high. You're not a relationship expert, you're a doctor. But what can you say from what you've experienced and seen?
Look, anything you think about, I've seen in that little room of mine as a GP. Sometimes we do have to have some, a bit of relationship counseling. Partner support, family support, friends and family support is extremely important, when we're going through times of difficulties. It doesn't even have to be a cancer diagnosis. Some people are going through depression. A woman might be going through menopause. Okay, a man might, a partner might have, been laid off from their job. But yes, especially cancer. We know how big a deal a cancer diagnosis is. We know how challenging the treatment can be. It hits everyone in the whole family. That's when when you're at your lowest, that's when you really need the people around you to be there unconditionally. And frankly, if when you're at your lowest, those who you expect to be there showing you love and support, and then they're just, I think they're just showing their true colors, that they probably didn't love you in the way that they thought they did in the first place. And maybe it's as hard as it may be, and that's probably the wrong time to get that message, but maybe it's like, good riddance to them. Okay. And it's about my focus. When I get situations like that, my focus is on the patient. It's about absolutely doing everything that I can to support that patient. Okay. Whether that's with counseling, whether it's making sure I'm talking to them more regularly, booking more appointments with them, whether it's getting them to join support groups, or getting them to surround themselves with other people that love them, other friends and family members that love them, and getting them to build their self-confidence in themselves again, that it will be well again, and their life can be fully functional, and they can experience life to the fullest again, with or without that partner that's put in a condition of not being able to have sexual intercourse with them as a significant thing for them being in their relationship. But you raise a good point, and we see that it happens. Unfortunately, it's really sad. Yeah, it's really sad.
DJ Little, have you got any more?
No, that's it. I want to say thank you for that response.
Okay, thank you, Dr. Achmed. As we're coming towards the end of the program, before we go, Dr. Achmed, I just want you to, what can you do, or how can you pass on this message to us as men to take away this fear in us that we have, especially when you receive a letter from your GP that you've got an appointment to go and do. Okay, let me use myself as a case study. Few months back, I got 3 letters each and every month to go and do an MRI scan, which I was scared, because for you to receive letters 3 months consecutively for you to go and do blood test and MRI scan, the fear in me was so much that I had to contact Isata Sise. Like I actually took a picture and then send my appointment letters to her. And then she goes to me, Ishmael, listen, if they ask you to go for the test, just go. No, I know I'm a quick explanation. Just go. There's a reason for that. So how can you take this fearness away from, how can you advise men to actually just, whatever they say, whatever they're going through, to just put the fear away and go for medical advice?
Now, thank you so much. And without going into details, have you had the MRI yet?
I've done every MRI.
Okay, good.
And then DJ Little sat there actually told me that you don't get used to this thing. Me, like when he went through his procedure, he was so scared for someone that worked at NHS. And this guy was actually telling me off, you, until you don't used to this thing, me are not used to them. So I was like,
yeah.
So the doctor, they forget for sick.
Yeah, sometimes it's worse for healthcare practitioners. So look, you went through the MRI. Was it as bad as you thought it was?
No. You know, on your letter, when they tell you the side effects of the radiation, like you can 10 chances, let's say 100 out of 100 people, 1 will eventually get cancer and all those kind of things. So when I read the whole, the black and white print of the letter, I was scared.
Yeah, of course.
And I had to talk to Isata, and then she gave me the assurance, like, listen, just go.
Good. And look, and you've got a good circle of people around you, you know, well done to Isata. But you were so scared about this test, you went and had it, and it wasn't as scary as you thought. And afterwards, you're probably really happy that you went and did it, right?
Yeah.
Whatever the outcome is, you know, positive or negative. You see, you know, when we procrastinate, this is not just about healthcare, but when you procrastinate, when you delay on taking a decision, you only end up hurting yourself, right? So let's say you could be a letter from your bank. I don't know, if you've got a mortgage, it could be a letter from your mortgage company saying you haven't paid and then what happens? You stop opening letters, and it goes, and you get more letters, and you get more scared, you get more worried, and eventually something terrible happens. They take the house away, or something terribly happens. You see bailiffs at the front of your house. But maybe if you had opened the first letter, you could have put a stop to it. You could have given them a call. You could have arranged some sort of payment scenario. Anyway, so again, it comes down to fear. Okay, it's fear is the anticipation of pain, and it's never as bad as we think. And that's what I'll say to anyone, who receives letters like that. It's never as bad as you think. And even if it's the worst possible outcome, it's still much better to find out in 1 week than to wait 6 months down the line when they could have started some treatment that could have caused some, that could have cured you. But you wait 6 months, and then it gets really difficult because things are a lot more advanced. So don't delay. I mean, your story is a great one. Don't delay. We all get into, and I'm saying it's not easy for me, but I coach myself through these things. I tell myself, look, don't procrastinate. Open the letter. First, just open the letter. And if you don't want to read it yourself, give it to your partner to read it for you. Or you've got a good friend, a trusted friend, send them the letter. Because you're probably sometimes so worried. The first thing you're going to see is like, 1 out of 100 will have cancer. And you don't see anything else. That's all you see.
No, definitely, Doc. I was worried because going through my heart condition for years and then thinking, everything is fine. And then all of a sudden, in space of 3 months, I received 3 different letters. So I was like to myself, this thing don't come back. what did happen again? For letting recall me case back. So there was a fresh fear in me.
Yeah. But they're just looking after you. Just, they're just looking after you. The opposite is worse. That some patients who get forgotten about, and they're like, well, I haven't heard anything for 2 years. That means I'm okay, but they're not okay. So take action. Well done. Take action.
Thank you.
I agree. Just before we go, DJ Ish.
Go on.
We got some comments from Auntie Betty Fallon.
Oh yeah.
Obviously, it was in line with what Doc was talking about earlier. The partner engagement, where Auntie Betty says, and that's so important. What she mentioned there, says discussion with partners about symptoms is paramount, and it makes it easy to get empathy from partners. Because many a time for us as men, and you will know it, we spring this upon our partners when it's lastminute.com. We don't get our partners involved from the onset of the symptoms. If I don't begin week at 3 o'clock in the morning, I go do number one, and then I spend about 3 to 5 minutes in there just shaking it off. As soon as I turn my back, I shake it off, and then I come back to bed. An hour and a half later, I'm up again, going back, struggling. And then your partner is asking you, you okay? What happened? I noticed you go up about 2 or 3 times for the net. No, okay. I think that eat what I eat, you understand? And then that prolonged for months and months on. And then obviously when the penny drops, and that's when you start saying, say they send me letter, they say like, I can go now, doctor. I know if you know self-footing at this year. But we knew exactly, we had not got our partners involved from the onset. And that also is a shock to them and a surprise element to them, which is sometimes an unwelcomed or unprepared support, which we're asking. But at that point, we expect the partners to drop everything. So, and I think it's a good point Auntie Betty made there. So, and it's always, and she then said later on, always good to talk to close friends and family who will motivate you to go for investigations. So that's all. I just wanted to just buttress on what Auntie Betty said. And I'm conscious of time. I know we had a late start. So thank you for actually giving us that extra time to recover. So well done. And thank you to everybody that actually engaged. The program has been very informative. Thank you, Dr. Achmed, for choosing to talk about prostate cancer. But prostate cancer is not just about today. It's the first of the month. Let's continue to raise awareness. I've got the top up here. So let's continue to raise awareness about prostate cancer. And as much as we can, let's talk about it. As men, let's be confident, comfortable, communicative in whatever way we can. Let's talk about it, because when you look out there, there is so much awareness about breast cancer awareness and so many other cancers. And I just want, I believe on the onset of the program, I'm not sure where we touch on it. We are, as Black and minority ethnic groups, most likely to die of prostate cancer, which is, I believe, the statistics says 1 in 4, isn't it? Whilst our Caucasian partners, counterparts, and we'll have 1 in 8 chance of dying of prostate cancer. So it's imperative that Black men, Afro-Caribbean men specifically, engage in talking about prostate cancer. There are so many. We have one of our leaders in our community, Mr. Weber, who has actually done so many campaigns. Just the other day was on Channel 4 talking about prostate cancer, sharing his stories. So if people want to know more about prostate cancer, they need to visit Prostate Cancer UK, the website. And myself, DJ Ish, we've raised money during our runs for prostate cancer. Dr. Achmed, you had the T-shirt there when we went out there as well, and you've raised money for prostate cancer. I just want Selenian people, Selenian men, to just pack the ego, and let we just talk about prostate cancer, because it's real, and cancer is real, first of all, and if we don't get comfortable in talking about cancer, we're not going to be able to get the support, first of all, even before the cure, because you need the support then to be able to get the cure. So let's talk about it. We know it's very light in our tongues, and that's because credit to Aisat, as he say, and she's made that lighter in most of us in our tongues, and for making cancer very prevalent. And people then can doubt and say, how is DJ Little? They talk about cancer. So we're not making light of it. We're making it easy to discuss, because we want to remove the stigma. We want to remove the fear. We want to remove the taboo. We want to be able to make sure we brothers them able for talk about it. And if we should find ourselves in a position where, God forbid, we're in that, it's the heaviness has gone away, and then we say, okay, let's move forward. You know what I mean? We don't have too many Mr. Webers in our community who has undergone through prostate cancer and come out on the other side and then is happy to share his stories. I'm not saying they're not there, but we want to be able to have people like that to step forward. We see a lot of our sisters who have had cancers and the breast cancers, they talk about it. You know, I was so moved when I went to Afro Arts with Dr. Petrina Kamara talking about a diagnosis, about breast cancer. And it's beautiful to hear somebody like that. So let's come out. So Dr. Achmed, really, really, from the bottom of our heart, and I really say thank you for bringing, and let's talk about this. So I'll hand over to yourself to do the summary before Ish close the program.
Well, thank you so much. I buttress everything that you said. I think it's not an overnight work. It's not just what's happened today. This is just one platform, one rung along the ladder towards improving your knowledge about your health, so that you can be in charge, so that you can be a master of your own health, so that you can have, intelligent conversation with your clinicians, and that is the only way that we can take control. Okay, so don't be the person that just does what you're told. Of course, do what you're told, but do it in an informed way. Don't just go along, because sometimes you may not be getting the right information, and you should be bold enough to ask relevant questions, and don't sit on your symptoms. Come forward and speak to clinicians early. Come to shows like this. Go to ICITO shows. There are lots of other health awareness shows around, but ultimately, go and see your healthcare professional. Go and see your GP and ask the right questions. Get support. And for partners, I think what we touched on today was really important towards the end. For partners of patients, and we're all going to be patients of some description one day, let's be supportive to our partners. Friends, let's be supportive to our friends. Let's give that love and support. And you never know when you're going to need it yourself, and it may be when you're least expecting it. Thank you so much, everyone. This has been one of the most highly interactive sessions on the Facebook page. So thank you so much to everyone who's asked questions, who's been watching, who's shared it. We absolutely really, really appreciate you're all helping to spread the positive message around. So thank you so much. We look forward to seeing you again next month. And yeah, it's getting towards countdown stage, right?
Yeah.
It's getting towards countdown stage.
Yes.
That's right. So we might have a special one for you guys next month. We'll see what we'll have up our sleeves.
Yeah, definitely. Why? We just want to thank everybody that have engaged on the program tonight. Listen, if you miss out anything, you can go back and then watch the program. And then just like what Dr. Achmed said, and then DJ Little, let us engage. Let's make use of the opportunity that we have. If you've got any fears, just reach out. We've got lots of people that you can talk to. Dr. Achmed, ICITO, we've got people who are specialized in these things. Let's make use of them. They will take the fears on us. So just want to say thank you, Dr. Achmed. Thank you, ICITO, for sharing your knowledge onto the program tonight. Thank you to our viewers, and thank you to everybody that actually participates on tonight. Dr. Achmed will come up with another program, and we will share it out to you guys. Thank you. DJ Little, have you got anything to say?
Thank you very much. God bless you. Don't forget to continue to support Countdown Community Park Run and take on your exercise. And then, oh, let me just use this opportunity to say, we've launched the 30K run. Dr. Achmed, we've launched the 30K run today in November. So, yeah, this is your opportunity. What we're saying, basically, you don't need to be an expert. You don't need to be a professional like Dr. Achmed, like Ish, like myself, like
me. I'm not a professional.
we're watching your record. So you can walk, you can jog, you can run. It's a 30K. So 30K basically to run in November. You can choose your cause. You can run it for prostate cancer. You can walk it for breast cancer. You can jog it for whatever charity you decide. But what we're saying, as part of the Countdown Community Pack run, we want everyone that can and have the ability to engage in a 30K. It might look like a lot, but it's not. So how we've done it is about doing 1 kilometer a day for 30 days. Okay, today's been the first. So that means you can do a 1.2, 1.4 from tomorrow. So to walk 1.2 kilometer a day, that will take you about roughly 12 minutes, isn't it? If you pace yourself. So if you're going to run it like Ish, you'll be doing it like 4 minutes, because he flies, So basically, let's just engage. We're doing this just for fun, to engage, is so that we can get everybody involved in improving their cardiovascular activities. So it's 30K. And again, like I said, you can choose to raise money for charity, or you can do it just for fun. And what you need to do, once you do your 1 kilometer a day or 2 kilometer, just send your completed run or WhatsApp it, screenshots, send it to myself or DJ Ish, and then we'll collect it. And then the persons that complete the 30K, not the first person, the people that complete the 30K in November will receive some gifts in December. We will tell you the dates in December, but just bear in mind, it will be on the second week of December. So please, everybody's invited. You don't need to be an expert. You can walk it, you can jog it, or you can run it. Anything you want to say about that, Dr. Achmed?
No, I mean, I think, look, this is a great opportunity to just kickstart regular activity in your life in a really, really fun way. Doing 1 kilometer. I think when you break it down like that, it's like you should be thinking, of course I can do that. 30K, I just do 1K a day, just walk 12 minutes, and then you're there. But it's a really good way to get into habit. They say it takes 21 days to really embed a habit. And you're going to have the opportunity of 30 days. By the end of 30 days, you're not going to want to stop, and you're going to be a completely different person. Your blood pressure is going to be so much better. Your cardiovascular fitness is going to be so much better. Your cholesterol will be coming down. You'll be eating a lot healthier, and then you'd want to be just not stop and do it for life, so get started, join onto this, and, become a newer, better person. Don't wait until the 1st of January, New Year's resolution. Do it now. Make your habit, and your habit will make you.
Thank you very much. You've heard it from the doctor. Why? Don't look at the dress inside your wardrobe thinking, oh, in 2 weeks' time I want to fit into that dress, and then after the 2 weeks you go back, you go past the dress. So don't do that. Don't do that. Please. Joining in this campaign is 30K. You can do 1K a day or 2K a day. If people, DJ Lisa, I want you to actually explain this to people, for people who are using miles. So they may want to know the breakdown. Okay, so put it this way, right? And it's a good question that you've just asked there, DJ Ish. I've just got a question from Fatima. Fatima says, can I run it to raise money for COVID support? Yes, sorry, Fanta Tankura. Fanta, if you choose to raise money for any good cause, please feel free to do so. That's what we've said. And what we just want you to do is just like what Dr. Achmed is to change your habits. Just change your habits, start something new, and and then you don't know what's going to happen. So that's all we're trying to say to you. We just want you to change your habit, pick on something new. So a 30K, for those who are doing miles, will be 18.64 miles. So it's just over 18.5 miles. So hence the reason why we're also saying don't complete your 30K in 14 days.
that will be cheating. We want you to spend at least 21 days, so 3 weeks at least. So you don't put yourself under pressure. We want you to enjoy it. So we don't want anybody to go out there, walk 30K in one day and send us a victory lap. Not like that, or jog 30K. Okay, so it's 18.64 miles, which is slightly just over 18.5 miles. Thank you.
Thank you very much, DJ Little. Thank you. And for people who want to raise money, like Little said, if you want to raise money for whatever charity or whatever cause, you can use this as your opportunity to do that. Okay, so thank you very much. Thank you, Dr. Achmed. Thank you to all our viewers. We will see you again on the first week of next month.
That's with Dr. Achmed, but me and you are back on Monday next week.
Yeah, we're back on Monday. And don't forget, people, countdown is on the 11th of December. So the ticket, well, it's not ticket, it's free. You only pay for your meal, which is £25.
That's correct.
Then you guarantee a seat and a table. It's a red carpet event. And then we've got lots of goodies for you people. It's That's a free event, but all you pay for is your meal. So make notes on that. The flyer will be out. It's on the 11th of December. Thank you very much. Thank you to all our viewers. Thank you to all that engaged on the program tonight. We see you again on Monday.
Thank you. Everybody wave, 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 wave. Well done, people. Dr. Achmed, great show.
Oh, thank you, guys. Thank you, guys.
Ish, well done.
Thank you, Dr. Achmed. Thank you.
Well done, guys.
It was a great one and intense. Lots of engagement.
Yeah, lots of engagement, right?
Yeah.
It just goes to say that people that want to talk about this sort of thing is up on their sleeves. And it's good. It's good. We're gonna do more. Well done.
So next month, really like the countdown thing, we can literally just, if you want, just talk a little bit about all the different topics we've covered this year.
I think so.
That's fine.
And just people can come, they can ask whatever it is that they want to ask about along the, on any of those topics. We'll just put them all, on the flyer that will be covering this. It won't be a detailed thing on everything, but we'll just spend.
You get a timeline of all the programs that we don't talk about because.
I get them. Yeah.
Okay, so if you get them, fine. So if I will get them, then I can.
Yes.
A patchwork of it like that.
Yeah.
On the flyer.
Yeah.
So the plan is countdown at the 11th. But this year, what will they plan for do? Ish and I, we want to put a different twist onto countdown. What we don't do because the health and well-being don't become so paramount to we. We want to look at recognizing we countdown team, so to speak, and all the one the way they. So usually what we can do over the years is give presents and gifts to birthday celebrants them. We will still do that, but we're looking at possible giving certificates. So I don't know what's in your input. So one for give like a certificate. It won't be like they have flat certificates, like scroll like that.
Okay.
Certificates. That's what we want to do. So
nice.
What advice would you give?
I think recognizing those people.
Yes.
The one that we don't take part, we don't make the effort. Whatever the level, but I think that recognition there will be really good for them, but also for the other one the way they watch.
Exactly.
I think it's a really, really good thing. Really nice gesture.
Yeah. So I've taken the liberty, Ish, because we'll not be able for talkers. I've asked Farella, and we're going to take the liberty as well now for put you on the spot to ask you, Dr. Achmed, to be one of the hosts. So, because usually what we do, Ish and I will take like a back role to organize, but we can always get a host. So if you don't mind hosting it alongside Farella for we, please, because we usually do the presenting of the gifts later in the program. So far,
Yeah, no, for me, not a problem at all. Not a problem at all. Yeah, we go. Yeah, absolutely not a problem. How much o'clock you say like you gonna need we for the day for?
No, the show they start from 7 to 2 a.m.
Okay.
But round about between 10, 11, all meal for don't serve. So by 11, all them presentation and they for don't done. Then people can get at least 3 hours for enjoy themselves.
Now the new IB side.
Yes, yes.
Okay. Yeah, that's fine. No problem, man.
So the focus is to really drive in on people sitting down, having that dinner up and down, and then just like what you say, getting that recognition done, and then and then provide entertainment.
Yeah. No, good.
So please, so now for reach out now your calendar and spare that date for we do, sir.
No, definitely.
We know you're busy, man.
No, definitely. And for that weekend day, to be honest, is gone. We get a family organization where we can meet once a month. Then if they do, we get a meeting yesterday, but I mean maybe they do some other things them. So they arrange so they want to do the Christmas do on the same 11, but I will get them for move on to the Sunday.
Now that one way you will play for last year, the virtual.
Yeah, Naim.
Okay.
Yeah. Who's they do Achmed?
They know then they debate.